Well, hello, friends. I hope you are having a wonderful week so far. And today on the podcast, I am honored and excited to have my wonderful friend, Dr. Stephanie Gorka, with me. Dr. Stephanie Gorka, welcome to the show.
Thank you. Thanks for having me.
Thank you for saying yes. So, Dr. Gorka is a licensed clinical psychologist, and she's also an associate professor of psychiatry and behavioral health at the Ohio State University. Did you hear that? It's
Yes.
the Ohio State University. And another thing about Dr. Gorka is that she holds the Kaufman Family Professorship for breakthroughs in psychiatry and behavioral health. Okay. And she also directs the Division of Risk and Resilience, which oversees trauma, suicide prevention, and addiction programs across the medical center of the Western Medical Center.
Yeah.
So that's a lot of hats
Yes.
for a lady like you.
Yeah, it is. It's a lot of hats, but that's the way I like it.
So you are not only a clinician,
Yes.
but you're also a very passionate researcher.
Yes.
And that's kind of what brought our worlds together. And I have to say, Linda Kaufman connected us.
Yeah.
And I just have to pause here and give a Linda shout out because Linda is the queen of positive social connections.
She is.
And on today's podcast, you're going to learn about how risk and resilience play into our lives and how we don't have to avoid that and how we have to feel all the feelings.
Yes.
And Dr. Gorka is going to give us tips on how to respond rather than react.
Yeah.
To the stresses of life, to grief, to loss, and to all those emotions which we can label as bad.
Mm-hmm. Yeah.
So if you think that stress or some grief or difficulty is part of your life, this podcast is for you. Dr. Gorka, thanks for coming on.
Yeah, my pleasure. I'm such a fan and very happy to be here.
You know what? It's when Linda introduced us and I was like, oh, where have you been all my life? And then beginning to learn about you, I found out that, you lost your dad at the tender age of 8.
Uh-huh. Yes.
How did you deal with that? Like, do you even remember? Like, what?
Yeah.
How did you deal with that at such a tender age?
Yeah, I mentioned that because my interest and passion for mental health and for adversity and trauma is very personal to me and a lifelong passion. So my dad was a healthy person in his 30s and had a heart attack in the middle of the night. So, as a young child, I woke up one morning and he wasn't there anymore. So it was very unexpected. And our family struggled. We all struggled in our own ways of coping with that grief and loss and just massive life change. And it was the beginning of my own journey for my own mental health, but really thinking about the mental health system, psychiatry, just this whole world in the United States around how do we treat, think about, diagnose, recognize mental health.
I love that you're saying this. As a person, as Dr. Stephanie Gorka, this is not representing Ohio State. This is you. This is your own lived experiences.
Yeah. Right.
And as a clinician, you take your lived experiences, your clinical knowledge from medical school and residency and all your experience teaching and working, and you're able to help people like us.
Yeah.
Because you've been through it.
Right. I have many of my own lived experiences. Absolutely.
At what time in your life, from age 8, when you lost your dad and you're going through grief counseling, like what time, like you encountered, when was the first time you saw a therapist or counselor in your life?
Right after, when I was still 8, I started grief counseling groups through my church. And it was helpful in some ways, but I was very shy at that age. So it wasn't the right fit for me, I don't think. So I didn't benefit from it in the same way that maybe some other people would.
Did you even know what was going on?
I mean, to some extent, 8 has definite awareness of what's going on.
Yeah.
But around me, I think my siblings struggled a lot more than I did. And they, throughout the years, really turned to substance use for their own form of coping. And that brought all sorts of family challenges when you have 2 kids in the home who are using drugs and alcohol at a very early age, and just the never-ending navigating treatment centers, rehabs, fly them to Florida, come back. It was really chaotic for a long time and made me very aware of the gaps that we have in our system and some of the things that we need to do better for our community.
Your siblings started abusing drugs at middle school, high school.
Yeah.
So this is not an isolation. This is common in our society today.
Yeah.
So in our treatment centers, our hospitals, and our healthcare system, it's sometimes very challenging to navigate these as a parent.
It is very, very challenging. I mean, even for us that are embedded in it, it can be challenging because it's very siloed. Things are not always well integrated or connected, and there's no guidebook. There's no manual.
No.
So we wing it, and it could be really hard. And that is something that at Ohio State we're trying to do a lot better with, and me personally trying to do a lot better with.
Let's take you through after you see all this. You see the difficulty in your home.
Yeah.
You see your mother and the rest of your family trying to struggle in the absence of your dad, raising your siblings, and you go through high school. And you start volunteering at a very young age.
Yeah.
What inspired you to do that? And tell us about that experience. Is there anything that you remember about that?
Yeah.
That sparked your journey to medical school?
Yes. I was passionate about mental health. I knew that this was the path that I wanted to go down. I knew that I wanted to help people and help families like mine.
Yes.
So in high school, I was lucky. I had good grades. I was doing well. So I asked my school administration if I could leave school at half-day mark and volunteer in an inpatient psych hospital so that I could get real-world experience for my future career.
Wait, what high schooler does that?
Yes, this was in New Jersey. This was in Hamilton, New Jersey.
And they let you?
They let me. Yeah, they did.
And so you went there, you went and volunteered?
I did. I went and I volunteered and worked with patients and did things like art therapy and recreation time. I mean, I was still in high school, so I only had so many responsibilities. But again, it was another eye-opening experience of what mental health struggles look like, what works in our system, and really what doesn't.
Was that when you decided to go to medical school?
Yeah, I am a clinical psychologist, so I didn't go to medical school. I got a PhD in clinical psychology. So after high school, I went to college.
Yes.
And in college, I pursued this path with all my coursework and training. And I worked in a residential addiction treatment center, Salvation Army, in inner city DC. Another extremely eye-opening, fundamental, foundational experience for me. Of most of those individuals were unhoused, long histories of trauma, met criteria for every diagnosis in our, manual.
Yes.
And we're really, really struggling.
It's just so with a PhD in psychology, you understand stress.
Yes.
You understand mental health issues. You understand what it means by how do we take the struggles that we're going through on a daily basis.
Yeah.
How do we break that down and how do we handle that?
Yeah, I'm trained as both a researcher and a clinician through my PhD. So we get training in how to do therapy, how to work with patients, how to use evidence-based techniques and strategies. And we do so many clinical hours with lots of supervision and feedback. And we are also trained on how to do research, how to answer questions and hypotheses and test things so that we could hopefully develop new treatments and bring something new to our clinics and break new ground. So that is what I try to do now, is really marry those two things. How do those things go together? How do we treat people but also make new discoveries and bring something new, better, innovative?
Yes. In addition to what we already have.
Yes. Exactly.
Because right now, when we have people come in with anxiety, depression, stress, we have them, almost all of them, start with an SSRI.
Right.
So take, for example, we start with Zoloft. We take sertraline.
Yeah.
Okay. I come and I'm taking my sertraline. What else,
Right.
in addition to taking my sertraline 50 milligrams every day,
Right.
can you recommend
Yeah.
for me who comes in as a stressed individual,
Right.
trouble at home, trouble at work, or trouble in my life? If I'm coming to see you, generalize me as a patient. What other non-pharmacologic options do you add to me?
Yeah. Well, I'm going to take a slight step back and answer a broader, or I guess give context to what my real answer will be. So in psychiatry, and this is something that I am working on in my lab and my career, is you'd be surprised we still don't really understand all these different diagnoses. We don't have a good understanding of what is one thing versus another versus a different diagnosis. And yes, we have this book and it has labels and categories.
Guidelines.
And you can have a yes or a no. But what is underneath all of that? So I think something that really highlights this issue, if you will, is that people tend to have multiple diagnoses. That when you come to a psychiatry clinic, it is actually very rare to be diagnosed with one singular thing. That you're actually more likely to meet criteria for 3, maybe 4 different diagnoses. So what is that? What is mental illness? How does that make sense? That seems so problematic.
Yeah.
If you were sick in another, talking about other forms of medicine, and you went to your primary care and you said, they wouldn't diagnose you with a sore throat, body aches, fever. They would test you and say you have the flu. You have one thing that's giving rise to all of these different symptoms. And here is our treatment for the flu. But in psychiatry, we're still a little bit behind because we are still giving all of these different categories. But what if there is something underneath that is giving rise to all of these different symptoms? And wouldn't it be amazing if we could target and treat and hit in a very specific way that underlying root cause, if you would?
Root cause medicine.
Yes. And I believe that stress, tolerating stress,
100%,
responding to stress is one of those root causes that is something that differs person by person. And that something that can get very out of sync, very misaligned, and can give rise to all sorts of different symptoms, disorders, behaviors, maladaptive coping strategies, things like that. So tolerating stress cuts across these things is just such a core foundation for wellness, for well-being. So we need to go after that. We need targeted things that help people build up their ability to tolerate uncomfortableness, tolerate adversity, stressful emotions. And we are working very much on that. Not just SSRIs, but really building up our muscles around tolerating and responding to stress. And we have treatment packages that are 3 sessions, really short. Because people want to feel better sooner rather than later.
As soon as possible.
You don't want to wait 12 weeks to feel better. There's just so many reasons of why that is problematic. So 3 sessions just to get at what is stress? How does it manifest in your life? How do you tend to respond to it? And how do we build up that muscle where you gain that ability to handle the hard stuff? To deal and sit with the hard stuff and feel confident in your coping skills. So we talk to people about that, not about their depression, not about their panic disorder, whatever your label might be. How are you tolerating stress? And how are you responding to that? But we're still also working, I should give nod to medications around that. Devices, innovative technology solutions. I think people at the end of the day always deserve options. So even if we're talking about stress and maybe stress is your thing, we should have a menu that we present at our clinics of, hey, here are the things that we know help with that.
Yes, and what works for you.
Which feels right for your own lived experiences, for your own preferences. And that's what I'm working on. I'm working on the menu that we can present to people and say, hey, I've really studied this.
Yes.
These are the things, these are the strategies that are helping people tolerate uncomfortableness better on a day-to-day basis.
I'm so excited about this menu. Now I want to see the menu.
Yeah.
So, but tell us, a little bit of insight to our audience about the research that you're doing at Ohio State University. I want to hear a little bit. Can you tell us, on a very patient-friendly level, what your research is about?
Yes. So one of those things is, like I said, going back to what is mental illness, trying to better understand it.
Yes.
And what that means is that we follow, track, assess huge cohorts of individuals. So just bringing in 16, 17, 18-year-olds right when you start to see these shifts in mood and asking them a ton of questions and looking at their brains and their nervous system and really trying to dig deep and underneath some of those thoughts and behaviors.
Yes.
And then doing it again 6 months later, again 6 months later, because I am very motivated to give us a better book, better answers, better labels that really reflect biology and root causes.
Science-based, yes. Evidence-based, yes.
And we only do that by having people come in and sharing with us their own experiences and being so giving us those samples and going in the scanner and giving us those pictures of their brain. So that is one arm. And then the other is testing these new treatments.
Yes.
Not for panic disorder, not for PTSD, not for depression, for stress.
Yes.
And really reframing how we're talking about things, what our outcomes are, what we're working on. So we are doing clinical trials, bringing people in. Hey, we think this medication helps for stress. We think this treatment package helps for stress. Help us better understand it. Fill out these forms, do these tests before and after so that we can figure out, does it work? But also, who does it work for?
Yes.
How does it work? And how do we put all that together to give people the right treatments for them at the right times so that they're set up for success?
Dr. Gorka, if somebody is listening to us today and saying, oh my goodness, she's describing me, she's describing my child, can people just opt in and participate in these clinical trials?
Yeah, I think there are many ways to get involved in studies like this, and they are plastered all over the internet and Ohio State websites.
Are we able to put some of the links in our show notes? All right, thank you.
That would be great. I do think that this resonates with a lot of people because like I said, going back to this idea of stress and unpredictable stress, of how important that is. So if you think about, something that you're not sure how it's going to go or what it's going to look like, but you're worried, you feel that, that you're looking around, you're wondering where the danger is, you feel very on edge, your breathing might be faster, you feel your stomach is clenched. That feeling that people walk around, something bad can happen, but I don't know where or when or exactly what it will look like. That feeling is, and just that persistent feeling can be really, really hard. And if you're really sensitive to uncertainty and feeling really on edge and responding to that, you might benefit from some tools, some education around uncertainty and stress and what that feels like and looks like in your body. And I think this is something that makes sense once you think about it.
It makes a lot of sense.
Yeah.
You're describing a lot of people when you say that. When you say that, I'm like, oh my goodness, she's describing everybody.
Yeah.
Because a lot of people fall into that category and we just tolerate it and we hold it.
Yeah.
And because our society doesn't encourage us to talk about mental health issues.
Yeah.
I suffer with it and I just think that I'm alone. I'm special and it's just me and I don't need to share this with anybody else.
Right.
Because I'm just the one suffering. I'm just gonna struggle with it alone.
Yeah.
Meanwhile, there are options.
Right.
There are menus.
Yeah.
There's possibility.
Absolutely. And going back to something that it's practice. So one of the things on our treatment packages is that we talk to people about uncertainty. That for all individuals, when we feel unclear, we're not sure how things are going to go, we feel anxiety, we feel on edge. So to be able to recognize that and understand of like, hey, I'm really feeling, out of sync. I'm really feeling like my breathing, my heart rate is up, like what is going on? And if you look around and sort of take a snapshot or observe what's around you, you can maybe label it and understand that uncertainty might be fueling some of these feelings. So we educate people a lot on what that looks like, what their own triggers might be, how that looks for them, but also some level of acceptance. It's okay.
Tell me about the acceptance. Yes.
To feel anxious. It's okay to feel on edge or unclear of how things are going to go. That's such an inherent part of life. We can't predict the future. We do not know all of the details of all of the things. So it is something that can be acknowledged and practiced and appreciated in its own way that sort of reframes it. It gets you to think about things a bit differently.
Yes. So kind of normalizing and acknowledging and appreciating uncertainty.
Yeah.
And then once I normalize, appreciate and accept that, okay, I'm not going to know everything that's going to happen tomorrow or next month or next week or next year.
Right.
How do I sit with that? How do I get comfortable with that? Yet still wanting to put together the things that will make my life go forward.
Yes.
How do I balance that?
Experience and confidence. I think that is something that I hope for everyone, that they have confidence in themselves, that they can handle the hard stuff, that I can feel anxious, I can feel on edge. I'm waiting for my test results to pop up in my mind chart. And I have to sit with that. I have to sit with the unknown. I don't know what it will say, but that I have confidence in myself, that I've done this, I've handled it, I've been there, I can handle the hard stuff, and I've practiced it. So again, going back to what do we do with people who want to boost their resilience or boost their stress tolerance, is we have them do small practice.
Like
and a really funny one with teenagers.
Give me an example of a small practice.
Is going out without your phone, which really has people lose their minds.
Okay.
So the idea is to expose yourself to unpredictable stress, to uncertainty, to uncomfortable situations, and practice in a low dose way of coping, of practice with your coping. So something that we ask young people to do is to like go out into the world, whether you go to the mall or something, without your cell phone. And because that's such an anchor.
As soon as you say that, I'm like, what if something happens?
Right. Exactly. There you go. You're on the spiral of the what ifs.
I'm like, what if something happens and you don't have your phone?
Right. So,
because we're so addicted to our phones now.
Yeah. Well, yes. And it brings a lot of predictability.
Yes.
And it brings a lot of certainty and a lot of information. But it is a way to practice being a little bit uncomfortable, not knowing exactly where you're going to walk, where, whatever it might be, who might be texting you, who might be calling you.
Yes.
And it is something that seems kind of silly and simple.
It does seem very silly.
But it is, just a clear example of how to practice and just build your own confidence that, hey, that was not so fun. That wasn't the greatest. But I got through it. I got through it. And I can do that, and I can build that up.
That is beautiful. This podcast is sponsored by Journeys, your path to intentional wellness. Most health problems don't start overnight, and neither does wellness. With Journeys, you can take charge of your health before you have to. Every cell in your body is speaking to you. But when we ignore preventive medicine, we wait until those cells are screaming. Journeys helps you listen to the whispers. There are 3 different journeys to choose from, each designed to meet you where you are in your wellness path. The Core Wellness Journey for $199 offers a foundational look at your overall health, perfect for getting started and measuring 66 biomarkers. The Advanced Heart and Metabolic Health Journey for $339 measures 111 biomarkers and goes deeper into cardiovascular, metabolic, and thyroid health for a more detailed picture. The Comprehensive Longevity and Hormone Journey costs $469 and is the most complete view, including hormone, nutrient markers that support energy, balance, and healthy aging. This measures 120 biomarkers. Each journey includes a personalized recommendation, one-on-one care from your pharmacist, and follow-up support to help you turn results into lasting intentional change. You just won't get data. You'll get guidance, accountability, and a partner in your wellness journey. Intentional living means paying attention, staying curious, and taking steps towards the health you deserve. Start your journeys today. Click the link in the show notes. So I want to talk about a powerful experience you shared with me. As a child, you used to journal. You journal to take you through these difficult situations.
Yeah.
And that is something that I have found. I journal with my daughter. We are on almost day 700 of consistent journaling.
Oh, wow.
And we make sure that that's one thing we do every single day, even if we're not together. And that has been so powerful. It's been transformative entirely. And that's not something I would pay for anything. But I had a patient who came in and said, I encouraged her to journal, and she said she will never ever journal.
Oh, wow.
Because she used to journal and somebody in the family found her journal and read it, and it led to a whole big family fiasco, and her marriage broke down, and she lost her children, and things just went negative from that journaling, and she will never journal again.
Yeah.
So I shared with her an experience which kind of similar to what mental download, writing it all out, everything that's in your brain, write it all out, and shred it.
Yeah.
And you mentioned doing something like this to cope.
Yeah.
Was this high school or middle school? Where did you start?
Yeah.
When did you start mental downloading?
Probably in middle school, going back to how I shared that my family was struggling in different ways and going through a lot of things. And for me, my form of coping was journaling. No one told me to do that. I have always had a passion for writing.
So tell me how, like the story of how that happened.
Yeah, I just got a folder. I don't know. I found a folder somewhere and had loose leaf notebook paper. And one day I was really, really upset about something. And I just sat in my room and sort of slammed the door and just started writing these really angry and frustrated thoughts out on the paper. Just sort of spilled it all out there. And at the end of that, I felt a lot better because it was released in a way of something that I was bottling up. And I remember writing on my folder, do not read, beware, you don't want to read this, like all of these warnings on it. And I hid it under my mattress because I didn't want anyone in my family to see it. Because even at that time, I knew it was almost just chaotic thoughts. They weren't meant for sharing for anyone. But I think an equally important strategy is that I would go back to that folder maybe a day or two later. I would be thinking about what I wrote, and I would say, let me read that. Let me see what I put in the heat of the moment. And I would read it. And that was really powerful in a lot of ways because I would say, wow, I would see it a little bit differently now that I'm 2 days out from that experience.
Just 2 days out.
And it was helpful for me to look at it in a different light, to almost re-examine some of my thoughts and feelings. And I was, in a way, learning from myself.
Yes.
And being my own little therapist, I guess, of, re-examining those thoughts of like, was it really that? Or was I just interpreting it that way? You question. You start to question some of those thoughts and reactions, which is a very healthy thing to do in general. We often have irrational really heightened, really exaggerated thoughts that are valid in the moment. But when you really break them down, you could say, oh, it's not exactly like that.
Yes.
And the reframe really helps. So I did that with myself, but I would get embarrassed about how intense and chaotic those thoughts were that I would rip it up and I would throw it away. Because I didn't want anyone to read it, because even then I knew that it wasn't how I felt then. It wasn't my ground truth, I guess. It was an expression. And that was just so helpful.
That was therapeutic. That's therapeutic. So that's what you encourage patients to do.
I do.
A mental download. Write it all out. If you're somebody who journals, you can write in your journal and keep your journal. But if you're somebody who is not going to journal, you can write it down. Come back to it a few days later, read it. If you want to keep it, keep it. If you want to shred it, go ahead and shred it.
Absolutely.
But that's very therapeutic.
Yes,
you say.
Because this goes back to a lot of what we touched on in this conversation of acknowledging your emotions.
Yes, ma'am.
Recognizing them, acknowledging them in that heat of the moment. I had those emotions.
Yes.
I didn't try to distract myself. I didn't try to avoid, squish them, bottle them up. I had them. Yes. And I had my whole moment in my
just
room,
like everybody else.
And I let it all out because they were valid at the time.
This is why I love you. I love you because when you talk to your patients, when you talk to us, you are using your life. You're using your experiences and your clinical know-how to be able to help us. Yeah. So it doesn't get any better than this. I really appreciate you using your own life. You've been through it. You've been pulled to the left, to the right, up and down. So there's really no patient that we can bring to you that you've not seen something similar to that. You and from the research and the scientific background, you can be able to help everybody that comes to your practice.
Yes, that is the goal.
This is the goal. We're gonna put a link to in the show notes to the research you're doing at Ohio State, and so that way people can find you to participate in this. I'm so appreciative of you being here.
Yeah, thank you, and thank you for this conversation. I do want to give hope to people that I said what I'm trying to fix in psychiatry, but I also want to acknowledge that we do have great tools.
We do.
And that there are a lot of really great strategies so that anyone who's feeling like they could benefit from help, someone to talk to, I encourage that, promote that, shout that from the rooftops.
Yes.
That we do great things every day.
Yes.
But I think that we could do even more, even, quicker, more efficient, and really, like I said, go get at that root causes. And I just, to give hope, we are working on that every day, and we are getting closer every day. It's still in research phase. Somewhat,
no giving up.
But it's going to get there. We're getting there. We open new clinics and think about them in more integrated ways.
Yes.
How do we think of these things, of how they go together, mind, body, all of the stuff?
That's the passion. That's the passion, and this is how we connect, because we're thinking of medication, but we're thinking of these pillars. We're thinking of nutrition.
Yeah.
We're thinking of what you're putting on your plate, how it's affecting your mental health, how you're moving your body. When you move your body, BDNF gets produced. How is that helping you mentally?
Right.
And inner alignment, all those biomarkers that we're measuring, and mindfulness, and building resilience and strength and grit, and all these, and positive social connections.
Yeah.
It's all the pillars of intentional living coming together with this research to help us, really augment our mental health.
Yeah, absolutely.
So we need to feel better about ourselves every day.
Mental
and I
health
love
is
how you
important.
encourage us.
Yeah.
I love it, and your passion with it, your voice gets louder and you're like, yes, we have to encourage it. We could do hard things.
We can do hard things.
We can do hard things because we've done so before, and we've practiced.
We practiced.
Even though it was little practices.
Yeah.
But we're strong enough.
Yeah.
The mental muscle is resilient.
Muscle.
I love that.
Yeah.
This brings us to my favorite segment on the show, and it's a supplement school with Emla. So no exams in the supplement school. So we're just I'm going to teach, but no exams at the end of it. So Dr. Gorka, what supplement is on your mind for supplement school with Emla today?
Yeah, I think about that a lot because I'm always trying to think about new strategies and tools we
Yes.
can bring to our
Yes.
patients. And I know that we've talked a little bit about L-theanine
Oh, I love.
as a
Yes.
potential supplement and tool for stress and
Yes.
for well-being and
I
rest,
love
feeling rested and
I
all of those
love
things.
L-theanine.
Yeah.
I love L-theanine because the thing is that L-theanine is an amino acid. It's a naturally occurring amino acid which is found in tea leaves. So the thing is that with certain tea leaves, like green tea, it can have chemicals in them which can elevate your blood pressure a little bit, and so tea leaves, and you think of caffeine and you think of, increasing blood pressure. But L-theanine is one of those naturally occurring amino acids in tea leaves which promotes relaxation. So kind of helps to counteract stress from heavy workloads. So think about when we always say, the British drink tea all times of the day.
Right.
So when you're drinking tea, herbal teas especially, and when you're drinking tea, you have that feeling of relaxation and calmness.
Yeah.
It's not just from the carrying a cup of tea to your mouth and drinking it. There is also this L-theanine, which is in the tea leaves, which goes into your body. And the L-theanine, what it does is that it increases alpha brainwave activity. And so alpha brainwave activity helps with that restful relaxation.
Yeah.
So it helps with that relaxation and wakefulness. So it doesn't cause drowsiness, but keeps you relaxed and kind of reduces your heart rate.
Yes.
So, and the good thing with L-theanine is that it doesn't have any drug interactions with SSRIs and SNRIs. So the common antidepressants and anti-anxiety medications that many people are on. So it's something that is a good add-on too. And always consult with your pharmacist. And I'll put a link to in the show notes for L-theanine. Stop by the pharmacy, call us at the pharmacy to see if L-theanine is something that will help you for relaxation and one of those tools to help with stress. And just think drinking a cup of herbal tea increases L-theanine, so if you're not a tea person, you could take the L-theanine capsule, but I love herbal teas. Those are one of my tools for relaxation. So thank you. Yes.
I think tools in the toolbox is really important, and that we should
Good to
have
have
a
all of them.
variety of things that we pull out at different times.
You never know which tool you'll pull out. And so, well, thank you very much for coming on the show, Dr. Gorka. We appreciate having you here and helping us give us more tools to help with our stress and to go about our days. If you listen to this podcast, my gift to you is Dr. Gorka, and your gift to me is sharing this podcast with a friend, a family member who you think will find this helpful. So you never know when you will help somebody. So mental health is not something that we will continue to be silent about. We will talk and we will share. So share this podcast to people so they know that they are powerful enough, they are confident to be able to handle whatever comes to them. So there's no giving up here. There's clinical trials going on. There's plenty of tools in the toolbox, no matter where you're at in life. Share this podcast with somebody, and so it can elevate somebody and encourage them for the future. Have a wonderful week, friends.
Yeah.